So today I want to talk to you guys about the Maryland Department of Health Laboratories Administration. It's basically an agency that's within the Maryland Department of Health and is umbrellaed under them. But first off, I want to talk to you guys about levels of prevention in population. Um, you have your primary, secondary, and tertiary levels. Primary is to limiting the incidences of the disease, promote overall health in a protective way, and establish preventative programs. And you have secondary, which is to prevent the disease progression. You have targeting high-risk populations such as drug users. You want to target specifically like hepatitis, for instance, because they share needles, so that spread of hepatitis is common amongst drug users because of that. And you want to provide early screening methods and early detection programs and intervention programs in order to counteract that spread. On the tertiary level, you want to reduce the disease spread within the population. So, for instance, an established disease, for instance, is diabetes within a population. You want to prevent that from spreading on and getting worse. So you develop intervention programs and wellness programs to manage or to rehabilitate those populations. So we talked about monitoring and diagnosis and investigation, which are two essential public health services. Monitoring, you want to monitor the overall health status of a population and identify the health problems within that community, and you want to test and track those health statuses within the population, so that you know what's happening, how it's spreading, how it can possibly be stopped or hindered. You want to diagnose and investigate. You want to have a means of being able to do that. So you might consult a reference testing laboratory, which also might investigate and also help to diagnose those diseases. They contribute to outbreak cases and outbreak case investigations, and they will work with federal agencies such as the CDC and the EPA in order to get that comparison and get the reports out needed to the public to educate them. So within the Maryland Department of Health Laboratories Administration, you have the reference and the diagnosis and surveillance in order to prevent and control and survey the diseases within the population. Like I said earlier, they're umbrellaed under the Maryland Department of Health, which is a larger entity. They're centrally located within Baltimore, Maryland, and provide complex testing for human and environmental samples. So you're more PCR and whole genome sequencing. So their mission is to basically protect the overall health of residences within Maryland by enforcing the standards and qualities provided to them by public, state, local, and federal agencies, and of course at a minimal cost, if free if possible, if they can provide the funding in order to provide the testing needed. So it's basically 5 divisions: microbiology, environmental science, molecular biology, newborn screening, and virology and immunology. Micro serves as a reference for typing. Environmental science, they provide analytical support to various other agencies and state departments, such as CDC, EPA, and local health departments, and state agencies to generate annual reports that can be delivered to the public so that they know like what's going on, how trends are going up and down. You have molecular to characterize infectious diseases. They also have a bioterrorism unit to identify those infectious bioterrorism agents that might be going around. Sorry, I'm in a library. um, and then virology and immunology for STI testing and antiviral resistance monitoring for antiviral resistance and multi-drug resistance as well. So a few of the programs and services that we provide are basically geared to protecting and safeguarding the citizens of Maryland. We provide analytical support and reference to CDC and FDA. Like I said, complex testing that, for instance, like we have regional and in Western Maryland and Salisbury, that they might not be able to handle certain tests, or other satellite clinics might not be able to do the testing that we can do, that other agencies that they can't do or that they can't handle. We also offer a means for the uninsured, like programs for those that are less fortunate, so that they can get the testing that they need in order to protect their health and improve their health. Like your free clinics, they will be under the state, and they will send us specimen in order for us to test. And it's, in a sense, to the individual, it's free, but of course, the state is basically paying for these tests to be done so that these individuals within these populations can seek or be linked to the health programs that they need in order to get get what they need done to them to improve their overall health, basically. So we also provide emergency response support. So if there's an outbreak going on, we may take on a higher volume of it that the other labs, satellite clinics can't handle. So like outbreak relief, for instance, like right now we're going through a measles outbreak, and we're basically contributing to that relief. And we train other laboratory personnel. So all in all, you can find all this information on the MDH website, and it just brings the overall health of the state of Maryland to a more centralized location, to support and to provide a means of programs in order for testing to get done, and so that the overall health of the population of Maryland can be improved. Thank you.